Ivan. So I will start with my Peter O'Connor assessment, and that's the presentation of the case. Good morning, assessors. My name is Gabriele Sassi, and I will be today physiotherapist for Peter O'Connor, which is a 54 years male, which has been suffering from multiple sclerosis. The type is relapsing remitting for the past 15 years. We know from relapsing remitting multiple sclerosis that is the most common of the 4 types in the pathology, and the relapsing remitting is characterized by exacerbations in which they might last for some times, but then they remit and the patient can get to a similar point before the exacerbation in terms of functionality or of the problems. The patient has a previous medical history which he has been having for the past 5 years injection of Tizabri, 54 doses during this 5 years time. I suppose this is a particular medication for multiple sclerosis, but in the last 6 months he had an exacerbation of the pathology with dysmetria, slurred speech and choking. Now from slurred speech and choking we might guess that there is a pseudobulbar palsy problem, and from the MRI it appears how the cerebellar peduncles of the left side have been kind of damaged, scarred by the pathology. So since the cerebellar lesion follow the pattern of an ipsilateral symptomatology in terms of ataxia, I will expect the patient to be a left-sided ataxic. And I know that he's been probably referred for the logopedist for the slurred speech and choking, but I will double check about it. On the 10th of June, he was admitted into hospital at the Melbourne Hospital, and it stopped the natalizumab, and it started having plasmapheresis plus intravenous injection of dexamethasone, which is a corticosteroid. Now we know that gold standard treatment as a medical treatment for multiple sclerosis are high doses of corticosteroids and plasmapheresis, especially during exacerbations. The patient was then transferred in inpatient rehab, which he was in the inpatient rehab until 2 weeks before the session, and he's been having daily, twice a day, 2 visits from a physiotherapist and a visit from an occupational therapist. I got a report of EDS scale 6.5, which it means that the patient has got some difficulties on the walking and starting having some difficulties in functionality. It's a scale that goes from 0 to 10, and usually after 5 there are some significant impairment in the walking, especially from 6 on. So I suppose my patient will need a walking device to walk. And he's having ataxia, so difficulty on coordination and balance. I got a report of 2 weeks before our treatment, where the tug test was reported to be 34.5 seconds, but mobility assisted by 2 people, sit to stand assisted by 2 people, and ambulation 2 meters with assistance of 2 people and no device. 2 days ago, on another report, I got a tug test of 30.5 seconds, so it's getting better actually. Bed mobility assisted by 1 person, moderate assistant, sit to stand moderate assistant of 1 to 2 people with a 4-wheel frame, and ambulation was attempted outdoor work with a moderate assistance of 2 patients with a four-wheel walker, not a wheel walker. I'm sorry, I don't remember the correct name at the moment. He has even been tested 2 days ago in feet apart, eyes open, and he scored 20 seconds. Feet together, eyes open, 12 seconds. A straight stance, left was like 3 seconds and right was 5 seconds. Now I know that from multiple sclerosis patients, the symptoms that I might expect are gonna be pain, heat sensitivity, weakness, fatigue, and spasticity. So basically on this patient I see that my main impairment might be at the moment from the data that I've got weakness, pull bar, full balance, and ataxia on this gait. Anyhow, there is a whole bunch of other symptoms that I might have, so we'll have to go through a quite thorough assessment of the patient. It's 5 minutes, 5:30, so I suppose I have to stop. Thank you very much.
And what are you gonna bring with you?
I'm gonna bring my Pelican belt with me, and I will leave outside the room walker device, actually the high walker device, and I will bring it inside when it's necessary.